Hi, I'm Laura and I'm here with Quay Kinetics Physio talking to you today about hip dysplasia. Now, hip dysplasia is a very under-recognised and underdiagnosed condition, and this means that I get people turning up in my clinics who have been struggling with pain and symptoms for years and have not been able to find a reason why and haven't been able to resolve their symptoms. This talk is to tell you a little bit more about hip dysplasia, what it is, how to recognise some of those symptoms, and to see whether you might have some of those risk factors to be able to narrow down if this might be a way forwards for you. So what is hip dysplasia? Hip dysplasia is a condition where the ball and the socket that form the hip joint aren't giving enough stability. So you can have the socket, the acetabulum, is supposed to sit really nice and snug over the ball and creates a lot of stability through that bone-on-bone joint. Now, unfortunately, with dysplasia, sometimes there can be undercoverage, so it doesn't really provide enough stability. So the ball is not completely covered by the socket, and that can come in from the side or it can come from the front. Now, if that happens, then it's putting a lot of pressure on some of the other structures that are backing up the stability. So you've got a structure called your labrum, which is a lip of tissue that goes between the socket and the ball. You're creating a suction. So there's a really good video actually that I'll link with this that you can watch for how much stability this gives. So when the ball is tucked in nicely with this labrum, it takes a lot of pressure to get that ball out of the socket. So it really provides a lot of stability. But when we have a position of the socket over the ball that's not really sitting as well as it could, it means that it puts a lot more pressure on the labrum. We can end up with labral tears or a very inefficient labrum that's not doing its job. You also find that if this isn't giving enough coverage through the bony support and the labrum isn't giving enough support either, it puts a lot of other stress on the muscles surrounding that hip joint. They feel like they have to work a lot harder. That stability gets really difficult to manage, and then sometimes we start feeling symptoms in other areas as well. So when people do turn up to clinics, sometimes we will get knee pain, hip pain, back pain. You can have presentations in different areas that can all be either directly or indirectly related to that lack of stability through the hip through this dysplasia. So how do you know if you might have this? There are some risk factors that are really, really useful to know about. If you know your family of origin and you can get your birth story, this is really, really useful. So things to ask your family of origin. When you were born, were you a big baby? If you have a high birth weight, this is one of the risk factors that puts a little bit more pressure through the hips and is going to make you a little bit more vulnerable for having hip dysplasia. There is a condition called oligohydramnios, which is a reduced level of amniotic fluid in the uterus. That again is one of the risk factors for hip dysplasia. If you are a person whose family has a long line of conditions of hip issues, it is more prevalent in the female line than the male, but it's still important to ask all genders in your family as to whether they've had hip issues earlier than would be expected. So definitely have a little bit of an ask about that. And the last one is breech birth. So were you born breech birth as opposed to traditionally head first? There are some other things to ask about which are a little bit less medical language and a little bit more perhaps recognised through the generations as things that were useful or tried with people without necessarily having a diagnosis. So other things to ask are, have you ever heard in your family the term double diapers? If people have struggled with this in the past, sometimes people have used multiple nappies, diapers, to help give some support to the hips to hold them in a better position, to give them a little bit more stability and help them grow naturally in a good position. So that's a term to look out for. Also, were you late to walking or did you struggle to walk early on? These are some of the things that you can ask, again, your family of origin, if that's relevant to you, your brothers and sisters, your parents, aunties, uncles, grandparents, all the way up the line. Let's just see if there's anyone that recognises any of these symptoms. Also having an awareness of whether there are different creases on different sides. So as you look at your child, or as your parents were looking at you, did you have uneven creases from your glutes down into your thighs that were different on different sides? This can sometimes be an indication of hip dysplasia. Sometimes when babies are born and they are at risk of hip dysplasia, they're actually born with dislocated hips. So the ball is no longer in the socket because of this instability and this unstable position. So these are some things to look out for. So let's say that you have been struggling with pain and symptoms in your knees, hips, back for a very long time. You haven't been able to find a resolution. Some of these risk factors that we've just talked about here are maybe sort of triggering some flags for you and recognizing some things. What do we do next? So you can absolutely come in to see a physio and have an assessment done. And then if we suspect that you might have hip dysplasia, then what we would do is to send you for an x-ray. So we send you for an x-ray because this is the gold standard for diagnosis for hip dysplasia, and there are a few tests that you can do and a few angles that you can read on the scans to be able to determine whether you have a hip dysplasia diagnosis. There can be mild, moderate, or severe hip dysplasia depending on the angles that we find. And I can do another talk for you if you'd like on all of the different angles that you can find on your scans to see whether it's relevant for you. So we would do a x-ray to diagnose, and you can have different x-rays for different things with the pelvis. So if you are going for an x-ray, we would tell you to rule out a diagnosis of hip dysplasia. So if we are writing a letter to your GP, we don't just want to ask for a hip scan, we want to ask for one purposefully to rule out a diagnosis of hip dysplasia. That way they will know exactly which scans to do at which angles in weight bearing or non-weight bearing to make sure that we're getting all the right information to be able to rule in or out that diagnosis accurately. Now, we might also find that an MRI is a really useful thing to do as well, because in addition to having the instability through the joint, like we talked about with some of those more soft tissues with the labrum, with the muscles that may have been having to compensate, we would perhaps go for an MRI in addition to be able to look at some of the soft tissue, determine whether that labrum is torn or whether it's still intact, whether the muscles are struggling with inflammation, overcompensation, whether we have some tendinitis. All of those things we can pick up on an MRI. So we may advise an x-ray on its own, we may advise an x-ray and an MRI, or an MRI on its own, depending on what we're finding in clinic. So this has been a whistle-stop tour of what hip dysplasia is, what to look out for, and what we could do going forwards for you to help to get a diagnosis and start on a journey that really helps you tackle the underlying issues, get strong and stable, and determine what's the best next step in your journey.